Hello everyone, and welcome to my channel. This is Dr. Filomena Trindade, and today I want to talk to you about 3 common myths regarding health. There's many myths regarding health, but I'm focusing on 3 today. Myth number 1 is that high blood pressure or hypertension is thickened blood. Number 2 is going to be about anemia, and that anemia only happens in people who are overweight or obese or on thin people. Number 3 is regarding SARS-CoV-2 or the COVID-19 virus. That is a virus that can be transmitted in the air, that is aerosolized. Let's start with number 1. So number 1 is the belief that, the incorrect belief that when you have high blood pressure or hypertension, you have thickened blood. That is not true. When you have high blood pressure, what happens? What is it? What does it mean physically? Well, think of it as like a hose that is tied to a faucet. Think of the high blood pressure the same way. So think of our blood vessels are like the hose, and the faucet is our heart. And what happens when you have high blood pressure is that the pressure at which the blood comes out of the heart and hits the blood vessels, the arteries, is higher. And when you have higher pressure hitting the sides of the arteries, you have a higher risk or higher chance that there will be damage to the inside lining of the artery. That inside lining is called the endothelium. The problem is when you have high blood pressure and you can have that damage happening to the endothelium, you then have an opening where things in your blood can get deposited, namely cholesterol, for example. And it gets deposited subendothelially. What does that mean? It means it goes in because now there's been damage to the wall, so there's an opening, goes in and gets deposited underneath the endothelium, underneath that inner layer. And whenever something gets deposited there, our immune system recognizes as something foreign. So our immune system responds, creates an immune reaction that can continue to grow subendothelially, and that can then be dislodged. You can leave that area and get lodged in an area smaller, and that could be, for example, a heart attack or a stroke. So the issue here is that high blood pressure doesn't mean thickened blood. We sometimes use blood thinners in people who have high blood pressure if they have other risk factors, for example, for stroke or heart attack, but that's a separate issue, and that is dependent on many other issues or many other conditions or many other things. When you have high blood pressure, it's like you can turn on that faucet and have higher pressure, more water coming out of your hose. That happens the same thing in our blood. It's the pressure of which the blood hits in the blood vessel, the artery, and what a damage it can cause to the inner lining or the endothelium. So, to recap, high blood pressure doesn't necessarily mean thickened blood. Let's now go to myth number 2. That anemia only happens in people who are overweight or thin. Not true. Anemia can happen in anyone. And to me, anemia is not necessarily a final diagnosis. Anemia, when you're diagnosed with anemia, it's more of a symptom which you now need to figure out what the cause or causes are. And let's divide anemia into 2 main groups. There's many different types of anemia, but the 2 most common ones are a microcytic anemia. That's an anemia where your red blood cell is smaller. That is an iron deficiency anemia. So then you need to figure out, why are you iron deficient? Why are you losing iron? Are you not eating enough iron? Why are you losing iron? Right? Because I just said that a diagnosis of anemia means you have to do further research. It's not necessarily a diagnosis in my book, it's more of a symptom, although it is a bit of a diagnosis. But to me, it's something that needs to be further investigated, and you need to figure out why you're anemic and treat the root cause, right? You don't just give someone iron because they have an iron deficiency anemia, you want to figure out why do they become iron deficient and fix the root cause. In the process, they may require supplementing with iron, but you still have to investigate further and figure out why. So I said that there's two main subdivisions. I'm now dividing anemia into two main classes or two main types. The first one being iron deficient, and that's a microcytic anemia where the red blood cells are smaller. A macrocytic anemia is where the red blood cells are bigger, and that's associated with a vitamin B deficiency anemia. Most commonly, it's B6 or B12. It's also called a macrocytic anemia, whereas an iron deficiency anemia is a microcytic, so smaller red blood cells with iron deficiency, bigger red blood cells with B vitamin deficiency, predominantly B6 and B12, but some of the other B vitamins could also be a culprit. Now, that was the myth that only overweight people or thin people get anemia. The fact is anybody can get an anemia, and we then need to investigate further, work with your healthcare professional, and try and figure out why did you develop that anemia. Let's move on to myth number 3. Now we're back to the SARS-CoV-2 virus, or the COVID-19 disease. And I find it's particularly important that we talk about it now because we're coming up on the holidays, right? We have Thanksgiving coming up, and then after that we have Christmas, and then New Year's. And so I wanted to talk about a myth regarding SARS-CoV-2, or the COVID-19 virus, that I find common even among some of my colleagues, even among healthcare professionals. And that is that it is an aerosolized virus. That the COVID-19 virus or the SARS-CoV-2 virus is in the air and you can just catch it in the air. That is not correct. That is not true. Unlike the influenza virus, which you can be in the air, the SARS-CoV-2 virus or the COVID-19 disease virus, unlike the influenza virus, the SARS-CoV-2 virus or the COVID-19 disease virus is not aerosolized. It is a droplet virus, and there's several researchers out there looking at this, and there has not been any studies to date that have shown that this is an aerosolized virus. This is a droplet virus, which means you have to have close contact with someone, and when they're speaking, the aerosolized saliva has to hit your mucous membranes, or has to hit your hand, and then you touch your mucous membranes. And the mucous membranes are those in the mouth, in the nose, and the eyes predominantly. So what that means is then that social distancing, wearing your mask, washing your hands frequently and thoroughly and with soap goes a long way to preventing the virus. But there is something else, or preventing transmission of the virus, I should say. But there is something else that I want to touch on, and that is that since we are coming up on the holidays and we are social beings, we like social connection, we like being touched, being talked to, having that one-on-one connection, right? And particularly at this time of year when we want to visit our families and our loved ones and our elderly, for example, then what are we going to do? Because we want to try and avoid transmission of the virus, but we don't want to miss the social connection. Well, there's a recent study that showed that it is after 15 minutes of close contact that you're at higher risk for transmission of the virus. So how do we use this? How do we put this into practice? Why am I talking about this? Well, I'm thinking that that's something we can use when we're trying to have some social contact with our loved ones, is we limit the amount of time that we're in close contact. And of course, we have the other precautions, as I already mentioned, washing your hands, wearing a mask, social distancing, but also realize that it takes 15 minutes of contact to increase your risk for transmission of the virus. So we can sort of diminish our chances of transmission by avoiding our contact to less than 15 minutes. So let's go and review 3 things I talked about today. 3 myths that are not correct. Number 1, that hypertension or high blood pressure is thickened blood. Now remember, I told you it is the pressure at which the blood hits the inside of your blood vessels. It is not thickened blood. Sometimes in patients who have high blood pressure, we may use blood thinners to avoid other diseases, or to decrease, I should say, their risk for other diseases happening or other issues. Number two is that having anemia means you're either too thin or overweight. No, not true. And I mentioned that there's two major groups of anemia, the iron deficiency anemia and the B12, or I should say the B vitamin, because it could be 6B12 and some of the other B vitamins, deficiency anemia. Those are the macrocytic, which means that red blood cells get bigger when they're B vitamin deficient, and the microcytic anemias, microcytic meaning the red blood cell is smaller, and it's associated with iron deficiency. And then of course we have to look for the root cause. Now the third myth is regarding the SARS-CoV-2 virus, or the COVID-19 disease virus, which is that it is not an aerosolized virus, but it is a droplet virus. And that's why we can go a long way to preventing transmission. So my best to you, and I hope that these three topics have been helpful to you, and make it a great day.